Larson, and today I'm going to be talking to you about severe mental health diseases. Mental health diseases are destructive to those who have it and to those who love someone suffering with it. It is a complicated, heartbreaking sickness that is filled with confusion, frustration, and desperation. Mental illness is very common in the United States. However, it is often unknown by others how to coexist with those who are suffering with a mental illness. My mother and brother both suffer with severe mental illnesses. My brother has schizoaffective disorder and my mother has multiple personalities, which are both psychotic disorders. Mental illness is likely affecting someone that you know and love, and it may be a battle that is kept quiet. At the end of my presentation, the audience will further understand the importance of and the needs of nourishing the mentally ill to create a higher understanding for the mentally ill for a higher functioning society. We will discuss what mental illness is, who it affects, as well as the mentally ill patient, as well as others it affects, and the recommended treatments and options. What is mental illness? There are many mental illnesses relevant in society. However, today I'm going to discuss severe and persistent mental illnesses, which are also referred to as serious mental illnesses. According to Behavioral Health Evolution, a severe mental illness is often defined by its length of duration, the disability it produces, as well as the production of disorientations of perceptions, delusions, hallucinations, and unusual behaviors. Severe mental illnesses can create an unrealistic universe for those who are suffering. The general population will often mislabel or misunderstand those with severe mental illnesses. They can become misfits due to their lack of understanding of their severity of their mental state. A set of basic findings by GSS showed that nearly in a time of 50 years, the United States general population percentage of socially accepting and reducing outcasting of the mentally ill community has only risen 13.7%. With rapid development of technology and psychologists' further understanding of the brain, this low increase is devastating to the mental health community. Here I have a visual aid to show you of someone with dissociative identity disorder, which my mother also has. In this side of the brain, you can see someone with DID who has an unusually smaller hippocampus and amygdalas. That shows that it is a physical change, and the mentally ill do not have a choice of their sickness. Who is affected by mental illness? Behind a mentally ill person, there is usually an army fighting alongside to these destructive battles. There are general population activists, politicians, psychologists, and psychiatrists passionate in raising mental health awareness. Sadly, it isn't as publicized as it should be, which leaves family and friends of mentally ill near wreckage fighting them with their loved ones. Richard Schultz of the University of Pittsburgh states, the family care given would cost hundreds and billions of dollars to be maintained by a professional healthcare provider and would have physical and psychological strain on someone who is caring for a mentally ill patient. Battling a mental illness is not only affecting the person who is mentally ill, but the close relatives and friends directly, which is often underappreciated and underestimated, the strength that it takes to care for someone with a mental illness. There are many treatment types for mentally ill patients, and a lot of times it's a long, strenuous process that you have to figure out the right medicines and combinations of therapy. Severe mental illness can have devastating, lasting effects for a patient and their family, but the forms of treatment that National Alliance on Mental Health recommends are a combination of evidence-based medications, therapy, and psychological services. Mental illness seems to be an often avoided subject. However, with a gain of knowledge, it should be normalized in society. With further insight and compassion for the mentally ill and those supporting them and the treatment options, I encourage each of you to take it upon yourself to further your knowledge and to be a positive change for the mental health community and furthering and understanding those with a mental illness. Thank you.
For me.